Oftentimes patients might hear that I need a bone graft. And a bone graft is a way to either restore the bone that may have gone away from not having a tooth in your jaw, or prevent further bone loss from happening. Or a third reason might be to prepare an area for an implant or dental implant. Whenever someone loses a tooth in their jaw and doesn't replace the tooth with an implant right away, that area of the jaw will go through a process called resorption, which means it'll shrink from being used to hold the tooth. So if a patient is seeking to restore the tooth with a dental implant, a bone graft is placed in order to restore the bone that they lost. And bone grafts can be done at the same time that the tooth is removed from the patient, if we know that the plan would be to place an implant in the future, or even if a patient comes in with no teeth and they're looking for dental implants, we can regrow their bone in order to make it available for future implant placement. Bone grafts come in different varieties, so when a patient is speaking to their surgeon about having a bone graft, it's important to have this conversation with the surgeon about what type of bone graft would be best for you. Bone grafts can either come from you, the patient, that's using your own bone from one part of your body and moving it to another part, or you can have bone that comes from a different human being, not yourself. That's called cadaver bone. Don't let the word cadaver scare you. It's technically from a person who's no longer living, but it is not contaminated with anything that the patient may have had. It is usually, if you're using the right surgeon, would come from a special bone bank, which has a certain criteria which they use to screen patients to make sure that there are no contaminants. Certainly the bone that I use is from a company where they go through an 8 or 9 step process to purify the bone to make sure that you cannot contract any disease or condition that the donor of the bone might give you. The third type of bone graft is purely synthetic bone. It's bone made in a laboratory. It can be bone made from either minerals. It can be bone that's taken from another animal, such as cow bone. That's also been used recently. So it's important to have this conversation with your surgeon to discuss what type of bone graft would be right for you. There are reasons to use one versus the other in certain situations. The risks of doing a bone graft, number one, is infection. So anytime we do any type of surgery or anytime we put a foreign material in your body, there's a chance that it can get infected. But certainly putting the patient on an antibiotic and choosing the right patient, the right candidate for the procedure should eliminate that risk. There's also a risk that the bone graft will not take, and which means that your body will not incorporate all of this bone into the area that you're working on. The risk is relatively very, very low in a healthy patient. There are certain medical conditions such as diabetes, being a heavy smoker, patients that are maybe on chemotherapy for cancer. Those patients have an increased risk of either infection or an increased risk of the bone graft not completely taking. So that's an important conversation to have with your surgeon.